Hi, this is Dr. Kaan of the ACL Academy, and today I'm going to touch a little bit on quad stretching, especially early on after your ACL surgery. One of the biggest things that we're working on, more of a foundational part of the rehab process, is getting our range of motion back. And when we're talking about getting our bending back, our flexion back, there are two areas we focus on. One is the joint itself, right? So that's the knee joint. So we're trying to move it repeatedly, consistently to make sure that the joint itself is moving. But another part of having full motion is making sure the muscles have proper length. And a big muscle that contributes to this is the quadricep muscle itself. When the quad muscle is tight, it's going to prevent the knee from bending. And early on after the surgery itself, the quad function, the quad muscle, unfortunately, is not acting the way that we want it. And this can contribute to being a part of why we're having a difficult time of getting that bending back. And, you know, if you don't have a knee injury, it's very easy to stretch, right? So we can just grab our foot, pull it towards our butt, and this may not happen for months at a time until we can get not only good motion back, but also that we have some strength to pull it back out there. So it's very hard to get a quad stretch. And I've seen people try to do it on their stomach, on their side with a strap. I'm going to show you a standing version that I feel like is my favorite version. And I think it's also the easiest to do early on after surgery. And I can show you as well as how you can progress it level by level and make it easy for you to not only feel the stretch, but also have some big benefit to get that knee, to help that knee flexion and bending motion. Before I go further into that, guys, if you've been following the channel and you found some value here, please subscribe to it. If you have questions, comments, drop them below. And more importantly, if you have a fellow ACLer that can benefit from these tips and education, please share with them. We drop a new video every single week. So early on, you're going to be sent home with some crutches. And just so I can show you, the goal is to be able to get your foot, okay, on a higher block, right? And you're, you know, a few days out, a week out of surgery, you're not going to really be able to lift your leg, right? But you're going to have a crutch. And what I would suggest that you do is with the crutch itself, you'll take it and you'll flip. And you'll use this part of itself. And then behind me, you can see is basically 6-inch block. So not too much of height there. We're going to start with something low, but we want to be able to get our knee to bend a little bit. So we're going to take our crutch. We're going to use a flip side here to help pick up our foot. We're going to get that underneath our foot just like this. It'd be good if you have something to hold onto. You're going to transfer your weight to the opposite leg. And then you're going to use your hand to help your foot on to that block. Okay, once you get onto that block, you can see my knees slightly bent to about 20 degrees. It should be doable early on. Now, once we're in this bent position, how we're going to get the stretch is we're going to use the crutch to hold on to one side. If you can get your hand on the other side, like a countertop or something else to hold on to, all you're going to do is contract your glutes and you're going to push your pelvis forward. So if I'm basically trying to tuck my butt underneath my hips, and when I do that, we're going to get a hip flexor stretch, and then it's going to go slowly straight down. We're going to hold this stretch 30 to 60 seconds, and then you're going to repeat it. You're going to start with a low level like this early on, and then once you feel more and more comfortable, you'll go to a higher height. You can use your stairs as well, which will be about 8 inches, and then eventually you'll be able to work your way up to a chair. Same concept here. You could still use a crutch or a strap if you have one, but basically you're going to use the crutch itself to assist you onto the chair. And then once you get that chair height, the knees to about 90 degrees there, same concept. We're going to tighten our glutes. We're going to try to leave the leg as relaxed as possible. And then we're going to push forward. Once we push forward, we'll be able to get the stretch that we're looking for in the front of the quad there, and then lower and lower. I like this stretch because it doesn't put you in a vulnerable position when you're laying on your back, and it doesn't make it trickier to use a strap. And to me, it's the easiest one to do when you are in pain, don't have a lot of bending, and you can modify that, right? So as you saw, I start on a lower step, 4 to 6 inches. If you don't have a step like that, you can take a stack of books, put them on top of each other. As long as the knee is bent a little bit, you're gonna be able to use your hips like I did to engage them forward and to get a stretch towards the front of the leg. As you feel more and more comfortable with your bending, you're going to elevate that height. So you'll go from that stack of books to, let's say, a step at home, which is anywhere from 6 to 8 inches. And once you feel good about that, you'll go to 12-inch. And then finally, a chair that I'm sitting on could be around 20 inches high. And once you get to that level, you're going to feel more and more comfortable with the knee, the way that it's bending, and then using a strap. I utilize this early on, let's say a few days out, 1 week out, where yes, you're bending the knee, working on that joint movement, right? So as I touched on earlier in the video, bending the knee in the joint itself, working on the kneecap mobility. But the other flip side of it is the muscle itself. And the quadricep muscle is going to be super tight early on. It's not going to be functioning as properly as we want. We have to make sure that we're lengthening it and stretching it. And it's very, very hard to do that because, as I said, you can't get up and just grab our leg like that because it doesn't work. So we have to find ways to do it, and we have to find a way that doesn't make us uncomfortable and vulnerable. And for me, that standing stretch is my absolute go-to stretch. Use that early on, and then you can progressively build up to the levels that you want. And then once you get comfortable enough, you have some good bending. There are much more other variations that we can utilize there. Guys, if you found some value in this video, please like it. Please subscribe to our channel. If you have questions, comments, drop them below. We get to every single one. And more importantly, share with a fellow ACLer that can benefit from these tips and education. This is Dr. Kaan signing off, and I will see you guys next week.